Welcome to USMLE SART. We are committed to empowering IMGs. We're excited to guide you on your match journey. Don't forget to click subscribe and turn on notifications so you can get notified whenever we add new content. Also, follow us on Instagram and Twitter for the latest tips and tricks regarding everything USMLE. Now, let's dive into it.
Good morning, good afternoon, everyone. So this is our webinar on research. So is research really important? Can it help you or not help you in math? So we have a series of speakers today. Ashma, as you can see, is on screen, and we may have some of the other students as well, and Dr. Basure, who helps run the IRR program for us. But before we get started, let me ask all of you, do you think research is helpful? And if yes, what are the other things that can help you in match? So you guys, those who are going into the match, hopefully next season or in the coming season, what do you think are some of the factors that can help you match? So you can put it in the chat as well, and then we can get started. So what all factors there are, and I have a list myself, but if you guys want to talk about what you guys think can help in the match. So anyone in the chat? Okay, maybe it's too early here in the US, or maybe too late. If you have rotations and research, yes. So that's one way, of course, rotations or research. Yeah, and my request is to post messages to everyone, so not to host and panelists. So if you want to post messages to everyone, I think everyone can read. But let me get started, and I do have Dr. Basure as well, so I'll make it very, very quick. And then we can get into what is research really useful. So let me just share my screen first, and then we can get started. Yes, strong LOR. So someone said strong LOR, Lekha. I think that's a good one. Okay, so let me share my screen, and it's a very quick kind of list of factors. So for those of you who are going into the match, right, these are some of the factors that all of you really need to make sure you understand, because this will drive the match. So on the top is the score. So now, of course, step one is pass fail, so it's the CK score. So the higher the score, obviously the better. Each specialty has averages that you can look at in the NRMP match. So whether you need visa or you don't need visa, scores are what they are, CK score. But nowadays, depending on your profile, step 3 is also important. So scores, the USMLE, CK, and if needed, step 3 are one of the most important things that can actually give you a head start. And then, of course, is the relevant US clinical experience. So relevant US clinical experience. If you are interested in IM, for example, maybe the surgery USC will not help you. So relevant US experience, minimum 3 months if you're a recent graduate. If you're an older graduate, of course, this varies. And you should try to get USC in different settings: inpatient, outpatient, hands-on, different states, different cities, just to give you that level of diversification. So USC is also very important. Visa requirement, it is what it is. There are IMGs who don't need visa and IMGs who need visa. How this determines is because many programs do not accept H1 or J1, or they don't do H1B or don't accept J1. So if you don't need visa, the number of programs that are open to you just increases, but it doesn't mean that visa seeking applicants don't match. I mean, visa seeking applicants have a match rate overall of more than 53-54%. So but visa is what it is, and you possibly cannot change it late in the season, unless of course there is a change in your status. LORs. So strong LORs, obviously, like someone mentioned, are very important, whether it is from USCE or from demonstrated research experience, which you see at the bottom. So LORs are an objective assessment of your skills, experience, maturity, and the relevant work that you do. So strong LORs from US-based physicians, whether it is the clinical experience or research, really matters. That is something that can swing it in your way once the program directors or other read your LORs. If other things, let's say scores are average, LORs can really help. Year of graduation, and therefore the gaps you may have. Now, these are two different things. Year of graduation just means when you graduated. So if you graduated, last year or 2 years, 3 years before. So the more recent your year of graduation, the better it is. They do look for applicants who are recent graduates, but gaps are different. Gaps are you may be a 5-6 year old graduate, but maybe you had a home country residency, maybe you're working in your home country, so there are no gaps. The issue comes when you are an older graduate and you've been sitting at home preparing for exams, so there is no clinical experience, no research experience, and those gaps then become a red flag. Then, of course, when it comes to ERAS CV and personal statement. So all of this, your experiences, whether work experiences, research experience, US clinical experience, all of it comes together in your ERAS CV, and the story is weaved into the personal statement. These are very important. Before the interview, you are just a piece of paper. So if the piece of paper is well written, the chances of interview and then the match become very high. Then we come to the demonstrated research experience. So it's not in any order. So don't think that ERAS CVPS comes much later. So demonstrated research experience is absolutely important, and that's what the webinar is all about. One thing which is not here at this point is the interview performance. That is I would say, the final stage, but one of the most important phases of this journey. Once you get the interview based on everything, then how do you articulate your skills, your story comes out in the interview. In that 10-minute interview, how you convince the program that you are fit for that program and you bring all that experience that is valuable to the program. So the interview skills, interview experience, and interview performance is very important. Couple of other slides that I had. Let me just see. Yes. So this is charting outcomes for Match 2024 NRMP publication, very high level, but this just shows you the research experiences, the number of research experiences. So that means if, for example, you worked in a research job for 1 year, that is one experience, one research experience. If you maybe worked in 3 jobs in research in 1 year, so those are 3. So these are just the number of experiences that the matched applicants had, and this comes from the NRMP charting outcomes for match for IMGs. As you can see, it varies by specialty, but every specialty needs research. So while you can say family medicine, if you're a non-US IMG, 2 research experiences. internal medicine 2.1, and there are more. These are just the number of experiences. It doesn't really show the outcomes, but it just means how much experience you have. So this is one way to look at it. But the more important way to look at it is this next chart, which is your outcomes. Now, outcomes, of course, can be counted by way of your publications. Publications can be abstracts, can be poster presentations, can be manuscripts. And so this is only for IMGs, and one of the more objective criteria to look at your research output. So, for example, if you look at it, emergency medicine for non-US IMGs is 8, general surgery 22.
block code.
I think someone needs to go on mute. Dr. Basu, you need to go on mute. So if you look at the output, this is where it makes all the difference. So if, for example, you are applying to internal medicine and you need visa, now these are averages. It doesn't mean everyone needs 7. Some people have more, some people have less, but you get the idea, right? Internal medicine, on an average, 7 publications. Family medicine, slightly less, but still you can see pediatrics 5.1, pathology by its nature, very, very heavy on research, 12, and emergency medicine 8, like I said. So these are only select specialties. I think neurology is not here, but you have to understand research has become very, very important in the last 3 to 4 years because of increasing competition, because of step 1 going pass fail, there is no CS. So the way they can assess an IMG has become limited. CK score, like I said, is one way, step 3 may be another, USCE is another, and research outcomes are another. So that's what I wanted to just start off with. And now let me welcome my panel. So Dr. Basu Ray, who is a very accomplished physician, and he's a former AIMS, former Harvard, a former program director, very passionate about helping IMGs with research. So he's going to be our first speaker. And then we have Ashma and some of the other students who will speak about it. They are all our research students. So Dr. Basu, over to you. And
Thank you. Thank you, Mr. Khera. I appreciate that. I hope you guys can. Thank you, Reshma, for the warm welcome. It's a pleasure to be here, my friends, and I'm really proud. I feel very proud and privileged that I have so many young doctors ready to break the scene in the US, and you can do it. People have done it for ages, and you can do it. The only thing is that, as I think Mr. Khera was saying, and you'll hear more, is that everything has a protocol. Here also you have to go through the protocol. The protocol is simple, easy, but you got to know it. And only if you know it, you can play the game. It has indeed become a game. And the reason for that is that there has been an extensively increase in number of people applying to come into the American medical system. Now, before talking about that, let me tell you, what does America really need you? I don't know what you think, but it does. Based on a New England Journal of Medicine report, America will be needing thousands of doctors in the next 10 years. And in the next 50 years, it will need almost 125,000 physicians. Because America does not produce enough physicians. It needs physicians from outside. That doesn't mean it'll take anybody and everybody from outside just because you're a physician in your home country. But it does mean that if somebody in Germany or England is better than you, he's going to take that. He's not going to take you. Why? Because America is one of the last bastion of medicine where a person is taken exclusively because of his merit. Not because to which country he belongs, not because to what name he or she has, not because what is her skin color. They don't care. What they care is, are you a good doctor? Can you serve the American public as a physician here? So let's go through the journey and let's understand where we stand today for taking people. Like if I'm the program director, what is my choice and how do I play my choices correctly? Because don't forget, you can get into a program by whatever means, but a program director cannot take you into a program without following strict protocol, because he'll not only lose his program directorship, he'll never ever become ACGME, will kick him out from this whole job, because ACGME meets with the program director on a regular basis. ACGME meets with the program and evaluates the program on a regular basis. So if I take you who's not a good candidate, but I still take you, what will happen? Will you be kicked out? No, because ACGME does never faults the student. The fault is always with the program director and with the program. And that is the reason why the program is very strict. So what are my means by which I can take a student? There are three ways. First of all, USMLE. Okay, first of all, let me tell you the competition. Till 2023, we had approximately 22 to 25,000 people applying for residency. Last year, I don't know if anybody wants to guess. Do you know how many people applied? Any guesses? Anybody wants to text? Last year, it was double the number, 49,000 plus. So almost 50,000 people applied. And this is not my data. These are all from NRMP site. You can go Google NRMP and you can get down from this. So double the number of people survived. Why is that important? It is important because your chance of getting is immediately halved. Why? Because it's double the competition. Number one. Number two, last year there was 6% increase in American graduates. Is that a problem? In one sense, yes. Why? 95% of American graduate will get in. The worst numbers we have is around that. They will get in. Why do they get in? Unlike UK or Germany, which favors UK citizen or European citizen, America does not favor anybody. In fact, America is the only country where you give the same exam like an American. You give US, so there is absolutely no bias whether you're an American, whether you're a non-American. That is the greatness of this nation. But still American gets favored. Why? Because of the system. It's not a fair playing field for you guys who are non-American graduates. Why? Number one, America doesn't allow anybody to get into medicine before graduation. So every American candidate passes graduation, then sits for MCAT, which is the American Entrance Exam for medicine, for medical school. You guys get in. I got in after my class 12 because I was lucky to break the record in India and get it. Most of you must have done after passing standard 12. America does not happen. So when you do 4 years of graduation in America in some good school, even the shittiest school in America will get you a couple of research papers. So imagine you doing in, say, Stanford, in Berkeley, in Georgia Tech, you will end up having 4 or 5 research papers even before you enter medicine. So now you understand why it's not a level playing field. We have 90% of the students coming here with absolutely no idea of research. The 10% who have research have some case reports. Who cares about case reports? It's as good as trash. Nobody sees those anymore. 20, 30 years back, people used to see case reports. Nowadays, nobody even looks at those. So where do you end up? You do not have any research experience, even after MBBS or whatever your degree is in your country. Whereas even before entering medical schools, most of the American graduates have some sort of a research papers. Now, once they do medicine in America, they end up having a couple of more research papers. Plus, there's another thing which is also makes it a very, very irregular playing field for non-Americans. What is that? You guys are foreign graduates. I have no data when I, as a program director, see your CV because the letters from foreign colleges are not accepted. But suppose Asma has passed from an American university, American medical school, I will know how good clinician as Asma was, how did she treat her patients, how did she do her clinics. I'll know everything. Why? Because I get the dean's letter. Dean quotes out all these points in his letter. So I immediately know what sort of a medical student Asma was. Unfortunately, that's a big divider. So every American who applies, it's like a open, like transparent water or an open mirror where I can see their entire body, their entire face, their entire CV in real terms, which I want. I don't care what you do in your personal life, but I do care how good doctor you are. I do care how you treat an American citizen. I do care what is your research knowledge. So that is clear. So you understand how the field is completely irregular between you guys and an American graduate. Now next come to so the question is, can you make the field same? Absolutely you can. And that is the fun of America. That's why they say everybody can be part of American dream. But there is a process and the process is fair for so everybody can take part. So what is the process? Now you do step one. In my time, step one made a difference because if I get 197, you get 256, you pass and I pass, but you have 50% more, 50 marks more than me. So who gets in? You get in and I don't get in. Tragically, fortunately, or I don't know, maybe unfortunately, I don't know. Last couple of years, USMLE 1 does not come with a mark. It comes with a P and an F. So I might get 176 and still pass. You might get 257 and you are topping the list. You are a P, I am a P. So nobody can differentiate me and you and say, okay, Dr. Basure is not going to get in, XYZ is going to get in. It doesn't happen because in America, the program director has to go through subjective norms to choose you. There has to be objective ways to choose somebody and not to choose somebody. So unfortunately, step one has no value to me as a program director. Step two has a value to me and has been a value for last couple of years since step one failed. What is that? If you get more than 250 in step two, CK2, we take you. So that's a good step. But the tragedy is last year it stopped being a good step. Do you know why? Anybody willing to say why? Because unfortunately there are hundreds and thousands among the 50,000 who applied who have more than 250 in step 2. So again we are back to the non-level playing field. How do we choose? So if I cannot choose you by step 1, if I cannot choose you by step 2, step 3 is important for foreign medical graduates. I'll talk to that later on. But step 3 is not considered for getting you into the residency because no American gives step 3 in their residency. They'll give step 3 before the residency or after their residency in their own time. But for non-Americans, I always advise them to give step 3 because then it's easier for a program to take you. They know for sure that you are ready to come into American medicine. Because suppose they take you for residency and then you fail step 3 and you don't get in step 3, then what happens? So they don't want to take the risk. But that's a different question. We'll come to that later on. So once you have step 2 and step 2 and still you're a non-level playing field, how to make yourself on the level playing field? The only answer is research. Why? Because research tells you, I don't have any clinical information of you as a doctor. But you are lucky that American medical system gives research 50 or even 60% importance in a 100% score for research. And that's why there are cardiologists like me sitting at Harvard who have done only research all their life. And they are going to get most of the Nobel Prize in medicine are by clinical doctors, some only by PhDs. This is the difference between research in America and research in other parts of the country. So it is important to understand that research is important. Now, how important is research? When I cannot choose you by your step 1 and step 2. The only way I can choose you by research. So how come what Dr. Basure is saying is that the truth or false? It's easy to find out. Go to NRMP site. International medical graduate who have got into internal medicine have at least 3.3 research papers. That zero point 0.3 comes because of statistics. You cannot have 3.5 research papers. You have either 3 or 4, but statistically it shows 3.3. And people who have guaranteed got in have at least 7 research papers. So if you are planning to get into medicine, you are lucky. Why? The next numbers will shock you out of your existence. If you want to get into dermatology, you need 13 research papers. If you want to get into vascular medicine, you need 26 research papers. This is all from NRMP side. If you continue to do what you're doing, what USMLE is providing, USMLE Sarthi is providing you, that you have a registered research program, the program that we have where we not only take you through a 3 months course to actually teach you research, but actually at the end of it, we get you a research paper in not some shitty predatory journal. There are hundreds of journal. You pay them to 150, 2000, $1,500, $2,000, and they will publish your papers. And I know people who come and show me they have 5 case report published in MNDP. There are a whole bunch of them. I don't even want to name them here. If you want to get the names, and we don't publish in any one of these journals, because not only are they not accepted, they'll black mark you if you have in these journals. So before you publish your next paper by yourself, go to Wikipedia, type predatory journals, find out the list, and make sure in the future you don't even see their faces, don't even go to their websites. We publish in top level PubMed that sometimes even one paper will get you because we publish in the top journals. And that's unfortunately not free in America. Our course is slightly costly. I have no qualms about it. It is $2,500, which is costly. Because a journal teacher charges you 3,200 to publish one paper. One paper. You don't have to believe in me. Open up circulation, go open up open publication, and then publish. So then the second question you might ask is every paper 3,200? No, you can publish in circulation or these top journals without making it open. But that unfortunately will give me a good publication, won't help you. Why? Because this, if it's not open, you cannot send it to everyone you like who can open it and check it out. Your program director, 99.9% will not have subscription to circulation. So he cannot see your paper or she cannot see your paper. That's why we have to publish for your benefit in the open one. So when you publish and show them that you are published in Frontiers of Cardiovascular Medicine, BMC, Oxford, Circulation, JAC, that is Journal of American College of Cardiology, there's whole level of top level journals. Nobody can stop you from getting in. So that is where research comes. Research is no more something you do for the sake of doing. But research has to come, because without research, unfortunately, I can almost get you a quote drawn affidavit. If in 2025 we have 50,000 applications just like 2024, there's absolutely no chance for you to get in without research. Absolutely no chance. If you get lucky, we go back to our old numbers, 20 to 25,000 people. Then the fresh batch has some chance. Old batches still have no chances. Because if 70% people are from fresh batch, then why would I be bothered taking an old batch who doesn't have a research? They don't really care about old batches. They do care about gaps, about which Mr. Khera spoke about. But they do care about old batches who do not have research, because then how are you competing? A, you're old batch. They take it for granted you're not updated in medicine, because they don't care whether you're continuing to do residency, or you're a medical officer in Egypt, in Pakistan, in Libya, or in India. They don't care because they cannot get a letter that tells your clinical experience. So they don't care about it. For them, it's a black box. So you may be the professor, director of the world's largest center outside US. They don't care about it. For them, your experience is zero. So the only thing that will bring you to a level playing field is having the requisite number of research papers that will get you in. Yes, somebody has asked, is a couple of research? Yeah, you can have 40 research papers all below the mark in a predatory journal, and your CV can be 4,000 pages. Nobody cares. It's the value. You have one paper in Cell, Harvard will take you. One paper in Cell, one paper in Nature, one paper in New England Journal of Medicine. Your life is set. Harvard will take you, Stanford will take you, Yale will take you. And that's where our people go. Most of our people, after they do research, they got into Tulane, they got into VCU. This year, a fresh batch guy from Egypt, Omar, was interviewed in academic places. Most Indians can't even dream of getting into academic. They just dream into getting into American medicine in some damn community hospital. They got into America because America needs you. It's not that you need America. Don't forget, America needs you. But whether it's you from India, Egypt, Libya, Pakistan, or you from Germany, America is open. America has got no choice. America is going to choose based on how your CV and how your research experience is.
So,
So
Dr.
last,
I do have, some questions that are coming in, and I think other speakers.
let's answer them.
Yeah,
We can answer them, and I'll just make one more point, then I'll open to answer. So you have to get this research. So what we do in our research program is, when USMLE gives us a student, somebody wrote LOR is important, yes. But so I'm coming to that. We cannot. So you get LOR by doing clinical rotation, which USMLE Sarthi provides some of the best rotation. Mr. Khera will be in a better position, and the students here will be better position to tell you about them. You can hear from that. Absolutely. Without the three letters, you're not going to get in. ERAS does not allow you to get in. You can actually put in 4 or 5 letters also. If you're applying to multiple places, you can put other letters also and say, okay, A, B, C, I want for Harvard, C, D, E, I want for Stanford. But as long as each application has 3 letters, they are fine with it. So that's something you can ask USMLE Sarthi. But I'll tell you my portion where where we work together. So what we do is we do 3 courses. Asma is one of our students. She just did our course also. We send you 1 hour video which you can see sitting anywhere in the world, even in Moon or Mars. If you have once Elon Musk sets up a civilization in Mars, you can sit there and read it also, because all you need is an internet. So you can sit in your office, in your hospital, and go through it. But what is more important is every week we have a faculty to grind into you what is needed to understand. As a clinical research, don't forget that. Our intention is not to make you a PhD or make you a non-clinician. We want to make you an astute clinician. And unlike what ideas most of you have coming from other countries, in America, medicinal research is part of being clinical medicine. So we teach you that. Hand to hand, we show you. So at the end of 3 months, you have a paper ready, which then we work on that to get it published in some of the top journals, not in a predatory journal. You cannot show me one research that I did in my 20 years of 25 years, almost 30 years now of being a faculty, which was published in Hindawi or MDPA. There are a lot of them. I don't even want to name them. And it's easy to get their names. Go to check Google predatory journals and you'll get the list. I don't even have a single publication, because quality is very important. Second thing is that, so that's what we do. We give you a LOR. What we talk in the LOR, we talk in the LOR of your medical knowledge because we know your medical knowledge. We don't know your clinical knowledge. You may be the worst doctor on earth. I don't know. So I cannot comment on that. Or you may be the best doctor on earth. I don't know and I cannot comment on that. But I can comment on your medical knowledge. If you're not good in medical knowledge, you're not good in research. Since we train you, we know your medical knowledge, we write that. We write what research you did. We write about your research skill. Why is that important? That is important is within the first 3 months of joining whatever residency, doesn't matter, medicine, cardiology, surgery, pathology, gynae surgery, you have to do journal club. So you have to know how to present in a journal club. You have to do mortality morbidity conference. You need to know how to do mortality morbidity conferences. If you do not know, then you're dead. And America, they don't have any qualms on throwing you out. So then your life is finished. So you better learn these things. So we do that, and when we give a letter, the letter is important. How do I know? I think the letter is important because the great Dr. Indranil Basure wrote that letter. No, there are many other doctors who write letters like me. So that's not important. We know it by experience. We have a brand new, we have a batch in this batch who got interview over 14 interviews, which most Americans don't even get. Every interview he was asked, what research did you do with Dr. Basure? Why did you choose this topic? How did you do your research finding? Why? Because that program director wants you to publish when you're spending 4 years or 3 years with him. Don't forget his program is marked based on what his productivity is. So if he takes a guy called Indranil who does not even know anything about research and a lady called Asma who has published tons of research, who is he likely to get more publication out when he takes that particular person into a 3 years internal medicine residency? Is it me or is it Asma? Obviously, he'll take Asma. The probability of Asma producing more when she is a resident in his program is more than Indranil, who has never known what research is. So research LOR is extremely important and we provide that. And that LOR, they will go through it, they'll read it. And as Pawan said, and we actually also teach you the techniques in how to make your interviewer ask you question about research. And the fun part is the night before I have taught my fellows who did research with me, next day they went to interview and that fellow has texted me, and I've sent that to my other students also. That, sir, did you talk to my interviewer the night before? I said, no, why? I don't even know him. How can I talk to him? He said, he asked me exactly the same question that you asked. That's not a surprise because those are the questions we are supposed to ask. In America, I know what is going to be asked. That's exactly he was asked. So LOR. Now I'll stop. We talked about LOR. We talked about research paper. Last point I want to bring up. What you pay for is for one publication. If you stick with us and you continue to do more paper, take part in, we do bunch of papers throughout the year and we continue to publish. If you take part in those, you will have your name there. We are very fair. Anybody who contributes have their name there. So I'll be not telling Asma, okay, Asma, I got your number in 4 papers. I took $2,500 from you the first time. Why don't you first pay me $1,000 each for the 4 papers I'm getting in your name? No. This is a research institution to spread knowledge. This is not a business house. I'm not selling you cars.
So, for example, Dr. Basu, if someone stays with you for a year, so one, of course, they get as a first author, like, Asma is getting, but if they stay for 1 year, whatever other work they help in, they can get authorship in that as well, right?
Okay, so let me give you the answer in practical terms because theoretically I might tell you anything that has no value. One of my earliest students, Rito got 15 interviews all over the country. Rito was 2 years before Asma's batch. Rito joined Tulane. Tulane, as you know, is called Harvard of the South. It's one of the top academic institutions. Rito worked for me for 2 years. In 2 years, he got 6 papers. He wrote 2 chapters independently with me. With me, and he had 6 papers. He had 2 chapters, plus he had editorial contribution in 2 books. Rito got 15 interviews. Nandita also got into Tulane. Nandita worked for 1 year, got 2 papers in top journal, including um, top journal, and she worked with 3 books. She didn't write any chapter, but she did editorial work because your LOR says that Asma, is that Ejang? Is that a collect production? Ejang worked with me. I wrote in this 4 chapters, and she did editorial work. That's very important. If you can edit a journal article, you are done. You are going to be taken. Doing research papers, research articles, editing research books, because all of those goes into your research paper, your LOR. So every sentence of my LR is not saying, "Oh, Asma is a great clinician." How the hell do I know? I have not seen a single patient. Even if I write that, they'll just throw that letter into the dustbin, into the trash bin, because they know I am lying through my nose. Because I have no clue what sort of clinician should. But if I write Asma has got excellent research capacity, she edited my these 3 chapters. I'll name the chapter. I'll name the book. She is the author in these 2 books. In these 2 or 3. She worked for me for 1 year. She is the author in these 2 years. One of them has been published. 3 of them have not even been published, but they're on the process of publication. That's enough, because the program director himself knows it takes 6 to 8 months to publish. And that's why I tell even 3rd year, if you're in 3rd or 4th year, join us now. So that by the time
Yep.
you're a
So,
game.
yeah. So, I think Antra from our team, Antra, you can post the link for those students who may be interested in IRR. So, post the link so that we can set up some time with them and get more details. So, one more question, Dr. Basu, before I let you go. And the question is, if your number of publications are below average, can volunteering or some other things help your chances?
Yeah, volunteering absolutely helps you. That's what these guys do. Like after finishing her course, Asma is going to volunteer, right? We are not going to charge Asma, and Asma is going to pay me. Oh, absolutely, it helps. So she will be doing those 5, 6 papers, not because she's paying me to do these papers or I am charging her to have a name put it, because then that is fraud, that is immoral. Everybody who works for a paper has to get a name in. So yes, if you volunteer, you will have your name in.
Okay. All right. Thank you. And by the way, Antra has posted the link, so you can go there, set up time with us, and read more about IRR as well. So thank you, Dr. Basu. Let's move on, and we'll hear from Asma. Asma, welcome. Why don't you introduce yourself and go from there?
Hello. Thank you for inviting me. I tell you all about myself. I am Asma Zahra, and I joined Sarthi program this year. Actually, I have no idea that Sarthi exists. I do the web search and find it out that so many people get matched, and I live here in USA for a long time. I raised my family here, and unfortunately, even passing all my USMLE, including step 3, I am not able to get matched. So why I didn't get matched? Because as you guys know, I am an old graduate and I didn't do the research. I didn't do the rotation. And I said, okay, if somebody need it, they will see my score and they will take me. And this, as you know, for international graduate, this only not work. We have to put, or this is a fight, so we have to think how we can get into the residency. So what border should we cover? So if you leave that border of rotation and research and many other things. For example, if you did not do your step 3, low scores, gaps, so nobody will give an eye to us. They will throw our application in the start. So we need all that to build our application, and the research really can help. So I am doing research with Sarthi. So first I joined the Rapid Affordable Research, and my paper gonna be published soon. And I also work in that paper. And right now I am working with the Dr. Ray research program. And I can tell you that you can learn a lot of biostat, and really with a very good teachers. Even they tell you how to learn and retain it, and it will help you with your USMLE journey also, in step 1, step 2, even step 3. So you know why it is important, and then you apply practically in the research paper, and you know what you are doing. So I really like it, and I encourage all you guys to join it. And the other thing, I am telling you the secret. If you focus on your money issue and you don't want to travel, and everybody as a student, we don't have a lot of chunk of money, and Dr. Ray already told you it is very comfortable to sit there in India or wherever you live, in Africa, in anywhere of the country, like China. You can join this program, do your research with very reasonable amount of money, and you can add on to your CV, and it's really help you. So when I research myself, I find this program very doable. And comparing to all sort of money thing and with the other programs, here I find the rotation also very good, but I did not did rotation with Sarthi. I did with another programs, and they are not cheap. They charge you a lot of money. If you go and travel, they charge you, a good program will charge you from $3,000 to $5,000, and it not less amount of money. So when you compare with the research program, it is very feasible to do the research. Very feasible. Just sitting in your home. What time you give to the research? Only 2-3 hours, and it depends on you. You watch the video, you attend 1 hour class or a little bit more time, 1.5 hour, whatever, but it's not a lot, and it can be done. And I encourage you guys, if you want to increase your chances. And I am applying, I am working on this year for residency, and if I get some positive response from the program, that what kind of research I am doing, but I didn't publish it yet. So I was in the middle, so I just started. So I tell them that I just started, so I didn't get the response back. But I think if I have published, I might get 1 or 2 residency responses, or I can go in the soap match and can see if I build or can get some response, or maybe I get can match. So I encourage my fellows to do that too. Thank you. Any other question you guys can ask me?
Thank you, Asma. I know Dr. Basu. There are a couple of questions.
Yeah,
You can take it.
there's one anonymous attendee who has asked, I don't know if he or she wants to come forward. There are many postdoc positions available, then why should one prefer remote research? So people, I think there's a little bit of a misunderstanding. Who takes you for a postdoc? You are getting into postdoc after doing PhD in a foreign country, and most of them are not clinicians. Now, does doctor do PhD? Yes. If you're a doctor, you can do PhD. But remember, these postdocs are for 2 to 3 years. There is no guarantee they'll get you publishing, because their job is to get slaves who will work in their lab, kill mouse and rats every day, and make them get data, because data is the most important thing for these research labs. So I think there's a confusion. Whoever this anonymous attendee is, we are talking about two different things. So postdoc position is different, a totally different career. I mean, there's even no reason to be in this talk if you want to be after doing your MBBS or whatever your medical degree, if you want to become a non-clinician and become a researcher and do your PhD or already have done your PhD, yes, then you can do postdocs. Postdocs takes between 2 to 5 years, and then it'll be a totally non-clinical path. It is not done with clinical medicine. I hope I have answered your question, but if you do have any questions, because I don't want other people to get misled by your question. They'll think, oh, postdoc is an option. No, postdoc is not an option for us clinician at all. There's one more question by Vamsi Krishna. What about Coursera courses like AI related, machine learning and generative AI? Do those credentials add value to the CV? Absolutely not. Once they have absolutely no value to basic residency. Basic residency is you're basically a basic medical student, so you're basically a white paper. The program wants to take you as a white paper and then do the painting on that to make you a specialist. So if you're joining pathology at the end of 4 years, he wants to he wants to make you a pathologist. So if you have AI related experience or XYZ experience, great. That doesn't make me, if you're joining me as an internal medicine program director, I don't care whether you are a triple PhD in AI. Who cares? I want to see if you can see my patient. Want to see if you can do research in internal medicine. I want to see how you do manage patient in your clinic and internal patients. So all those courses has absolutely no value. And see, you have the entire life to do those courses. Waste your time, waste your money. God bless you. Please do it, but don't waste your time. Don't get thrown into all this nonsense. None of them work. If those work, then a million people could have done Coursera courses and swam into residency. We wouldn't have had USMLE Sarthi or IRR or all these people trying to get you in. So anyway, those are the two questions I wanted to answer. Thank you very much, Mr. Khera, for giving me a chance. And great talk, Asma. And take care, guys. Bye.
Thank you, Dr. Basu. Thank you. Let's move on. So our next speaker is Ijang Nagando. So welcome, Dr. Nagando. So over to you.
Can you hear me okay?
Yep, we can hear you.
Okay, perfect. So thank you for the invitation. And really, I don't want to repeat myself much. Dr. Basure and Asma have said everything.
Oh, looks like we lost you. All right, let's try to get her back. Antara, if you can, get her back. Maybe she's having a technical problem, but let me answer some of the other questions that are coming up. Is the research course with Dr. Basu remote research position? Yes, they are all remote research courses. Can research help me in covering the gap? And yes, that's the idea, right? So yes, research can help you. Of course, it does not mean that you should not have USC and others. So yes, research can help you cover the gap. And she is back.
I am so sorry. My apologies.
No,
I'm
that's
actually working, but I decided to, make sure I join this meeting. So again, thank you for the invitation. And similar to what Dr. Basure and Asma have said, research is so crucial. So unlike other people, I have a unique background in the sense that I've been a pharmacist for 10 years, and I went through residency in the States as a pharmacist. And as Dr. Basure mentioned, a lot of program directors, whether it's residency, pharmacy, medicine, whatever it is, they expect you to have had some involvement in research because it makes their job easier. So whether it's, remote research through Sarthi, as they mentioned, in person, basic science, any form of research gives them a chance to see that, you have some exposure, and it's going to make their job easier because, again, it's going to be a very difficult, time. So Asma had mentioned, she heard about Sarthi through the rotations. I also did. I actually did 2 rotations through you guys, and they were great. And through that, I heard about the rapid affordable research. So I did that. I'm currently in the process of getting something published. And it was a research project, which was great. But again, I encourage all of you to not let money be a factor because this is your future and it's so worth it. people sometimes may think that you need to have some fancy, publication or actually do research in what you want to pursue. At this level, I think that just any involvement is what they look for, and I think that you guys should not take it lightly, especially because with us not having step 1 scores, they will look at those things, whether it's volunteering, research, and the more that you can show you've had in that aspect will make you a lot very competitive. So I am definitely encouraging of that. Any questions?
So yeah, why don't you, you've done rotations also now. So I think it'll help if you can talk to students about importance of USCE as well.
Yeah. So one thing about having these rotations, again, whether it's remote, in person, or hybrid, it lets you have a chance of how medicine is being practiced in the US. So it's very different from other places. Again, I went to school through CCU, and I did my rotation in the States, and I think that everything from the system they have, the EMR they use, whether it's Epic or Cerna or I don't know, Meditech, that allows them to know, okay, well, they have the ability to navigate, putting in notes, dictating all of that. With the rotations, you have that experience. Having the hands-on skills, the bedside, exposure will also give you that advantage through the rotation. So I encourage all of you to pursue that. And again, I'm going to say this. People always think you need to be in person. I am in Texas, and I was not able to have all my in-person rotations in this location because, again, you'll know that many hospitals that are teaching, which I've worked at as a pharmacist, they give preference to their own candidates. But by you being part of SARTHI, you're able to still get that experience, which will add value to your application without, saying, okay, well, I didn't get a rotation in person at, let's say, UT Southwestern, so I'm not going to do it. But no, but SARTHI gives you that experience, whether it's, virtually, and it still adds value. So I encourage all of you to look into that. I was able to do a peds rotation and a neurology rotation through you guys, and they were amazing, amazing. So I definitely encourage all of you to pursue that. And as Dr. Basuri mentioned, the gap from when you apply and having that experience is crucial. So I finished medical school August of last year, studying for my exams right now. But my goal is that I'm going to look into getting another rotation that's within the time frame from when I'm going to apply. So you have that recent exposure. And for me, I'm a professional, I have other obligations, but SARTHI allows you to still have that amazing experience with amazing, physicians, but yet you're still able to, maintain your other obligations, which I think is also equally important. So I definitely encourage all. And again, I'm going to say this, pursuing medicine or anything in life that you have a passion for, it's not going to be, cheap. So don't let money really be, a hindrance to that, because it's the end that matters. And I really think that, as Asma mentioned, other places are quite costly, but SARTHI is actually quite affordable. And not only that, they give quality research. So I definitely think you guys should think about that. I'm happy to share my experience as well with you guys. And also the last thing is a letter of recommendation. Many of your preceptors that you work with through the program will give you a strong letter. And I like that, because sometimes some people, again, a letter of rec is not really required for some of the preceptors, but with the ones here, they will give you one. If you come in there with a great attitude and you show up, you make an effort, you participate, they will give you a good letter, which again we all need for applications. So I think that that's definitely comforting. So
thank you very much.
Of course.
Very, very helpful, and I appreciate both of you joining today. And I know you're very busy, so I'll let you go.
No, thank you. Sorry about the technical issue.
No. Thank you very much, and I'll take questions from here. But thank you. Thank you both. All right, so let me take some questions. So, how much is the commitment to research? So, 2 to 3 hours per week. And I think there's another question. Is it a smart tactics to do multiple research projects parallelly? I don't really subscribe to that. I think if you can multitask, but maybe do rotations, maybe even if they are remote rotations, then research. So rather than doing three research projects all together, maybe let's say focus on IRR or RAR, one of those research projects, but also build on the other side, maybe clinical rotations. I think that's always a good idea. Remember, you are going into residency, not a PhD course, right?
Mhm.
So either work experience or USC always helps. There's another question, is research helpful for job without residency? So it depends on what job you are looking for. So physician assistant, MA kind of a job, is that what you want? I don't know. So, if you are looking for clinical jobs, I think USC definitely helps, right? If you're looking for an MPH kind of a course and not residency, then absolutely research helps. Research also helps in residency. But if it's a clinical job, my recommendation would be definitely get some USCE. And I want to go back to the earlier question on postdoc positions versus, this research course and also. I think I also got a question if I'm getting a fellowship. So fellowship is different. Fellowship, if you're getting, say, in nephrology or ID or something without residency, because you have a home country residency, a fellowship is a different ball game altogether. So you should definitely consider that. In fact, many of our students who have home country residency do directly get into ACGME accredited fellowships, GI, for example, geriatrics. We got one in heart failure fellowship this year. We got nephrology. So they are all ACGME accredited, and a lot of students do fellowship first before they get into residency. So that is a very different ball game than a postdoc fellow. Okay. And that's what I think Dr. Basu was answering. All right. So again, what does this IRR cost? So I think there's a $200 discount, but as Dr. Basure said, you can be affiliated with them for 1 year, 2 year. It's only one-time payment, and there is at least one research full paper, and then depends on how much time you spend, you can get 2, 3, 4 out of it. So it's only one-time payment, and I think there is a discount going on. $200, but it does not mean only research paper. So I think there is a question on jobs without residency. So this is many states in the US have opened up this position. We did a webinar on this, I think 2 to 3 weeks ago, I would say, which is provisional licensing. I think there are questions on that. So for most of the provisional licenses, I'll guide you to our last webinar. Go and take a look at that. Limited licensing. Yes, so go and take a look. And then if you have questions, you can always get back to us. With that, I think we answered all the other questions. Again, if you have anything else, let us know. Antara, you can post a link on how they can set up time with us, and link to the research course, IRR, and then link to our rotations. And then if you have any questions, we can answer, or we'll see you in our webinar shortly, the next one, so in a couple of weeks. With that, thank you, everyone, and thank you to my panel. I appreciate both of you. Have a good weekend, good Super Bowl weekend. I don't know who you are rooting for, but whoever it is, may your team win.
Thank you.
Yes. Thank you so much, guys.
All right. Thank you.
Take care.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.